Pulsation, sometimes you can feel it here. This is which artery? Facial artery. This is the facial artery originating from the external carotid artery. So this artery is the common carotid, will divide into internal and external carotid. Internal carotid will not give any branches in the neck. All of its branches are inside the cranial cavity. External carotid will give many branches. The artery which will hook around the mandible here is the facial. So this is the facial artery. This is the facial artery. Type. One point, please, we missed this point. We said that this is the anterior belly of the gastric, right? What is the muscle which is located deep to the anterior belly of the gastric, and it has the same nerve supply, and it is forming the floor of the mouth? Bravo, mylohyoid muscle. So we have anterior belly of the gastric crossing superficial to the mylohyoid, and both have the same nerve supply. We have the posterior belly of the gastric together with the stylohyoid, and they carry the same nerve supply, or they receive the same nerve supply. عرفتش تعرفيهم ازاي؟ posterior belly of the gastric together with the stylohyoid. Anterior belly of the gastric is crossing superficial, bravo, to the muscle forming the floor of the mouth, which is mylohyoid. حبيبتي شايفه ولا لا؟ اجيلك لعندك؟ واضحه كده؟ كده. عشان ايه؟ عشان هذا طيب. So this is the posterior belly of the gastric, and this is the stylohyoid. This one is anterior belly of the gastric, fusiform كده, and the muscle which is deep to it is the mylohyoid, which is forming the floor of the mouth. كل اتنين ماشيين جنب بعض receiving the same nerve supply. واضح كده؟ طيب. شفنا submandibular salivary gland. Here on this aspect we can see again this is which sinus? Bravo, frontal. Which sinus? Sphenoidal. Allah ينور, sphenoidal. Which concha? Middle. Why? Because this is the hard palate. So this is the bravo, inferior concha. Middle concha. Very good. Superior concha. Which meatus? Inferior meatus. Which meatus? Middle. Which meatus? And the area above the superior we call it spheno. Bravo, bravo, bravo. Sphenoethmoidal recess for the opening of the sphenoidal air sinus. Type. Identify this nerve اللي له filaments كتيرة piercing the الله يفتح عليكم olfactory nerve fibers. These are the olfactory nerve fibers that are supplying the olfactory area of the nose, piercing the cribriform plate of ethmoid to end here at the brain. إيه حبيبتي؟ قولي. طيب. أهو olfactory أهو. These white fibers are the olfactory nerve fibers. تمام؟ طيب. This is the area of the vestibule of the nose. This is the very good hard palate. This is the and this part is the uvula. طيب. This is the برافو عليكم أو adenoid or pharyngeal tonsil 14. This is the palatine tonsil. اللوزة اللي بتفتحي بوك بتشوفيها palatine tonsil. 14 is the palatine tonsil. The two folds surrounding the palatine tonsil, one anterior and one posterior. Bravo. Palatoglossal anteriorly. نسيت. Palatopharyngeal posteriorly. Palatoglossal anteriorly. Palatopharyngeal posteriorly. طيب. When we put sticker here. Eustachian tube. Pharyngeal opening of the Eustachian tube. Pharyngeal opening of the Eustachian tube. And this fold posterior to it, we call it salpingio-pharyngeal fold. Why salpingio-pharyngeal? Because this tube, باللاتيني, we call it salpinx. So this fold, we call it salpingio-pharyngeal fold because it is arising from the salpinx, which is the tube, down to the wall of the pharynx. ليه؟ لأن all of this is the wall of the pharynx. This is the wall of the pharynx. This is the larynx, will be covered later on. Okay? طيب, muscles. Yes, bravo عليكي. Fan shaped is Glossus. Genio because it is arising from the genial tubercle of the mandible. Glossus because it is directed to the mandible. يبقى we call it genioglossus muscle. The other one deep to the genioglossus. We call it, yes, but we have two muscles actually here. The one which is forming the floor of the mouth, which is the first layer after the skin and fascia, is mylohyoid. The one which is above it, برافو عليكم, geniohyoid. تاني. From below upwards, we have here in this section 3 muscles. The one which is following skin and fascia and is forming, Allah يفتح عليكم, and is forming the floor of the mouth is mylohyoid. And then the other one from the genial, inferior genial tubercle to the hyoid bone, اللي هي number 16, is geniohyoid. And this one which is fan shaped is genioglossus. And this is the body of the mandible, and this is the lower lip, and this is the upper lip. واضحة بنوتيتي كده؟
Doctor, المايلوهايويد واضحة بالكده.
This is the mylohyoid. It does not carry any number here. But this number 16 is for the one which is superior to it, geniohyoid. And the one which is fan shaped, the مخرومة بالمسمار, is the genioglossus, which leads to deviation of the shape of the mouth if one muscle is paralyzed. واضحة بنوتيتي كده؟ طيب. Okay. Regarding the nose, this area we call it the tip of the nose. And this area we call it the ala of the nose. Tip and ala. Okay? This is the tip and this is the ala of the nose. These are the nasal cartilages. We have major nasal cartilage and minor alar cartilages of the nose. And this one is the lateral plate of the septal cartilage. Actually, the septal cartilage of the nose, we will see the septum now. Yes, in the middle. This is its lateral process, which is forming this part of the nose. This is the alar cartilage, major لأنه كبير, and these are the minor, one of the minor alar cartilages. And all of this area, we call it the ala of the nose. We missed very important structure, number 2. Number 2. Which sinus? Number 2. Maxillary. This is the maxillary air sinus, which is located here and here. This is the, خدي بالك هنا الفيس is open, صح? So this is the maxillary air sinus, which is located here and here. Can you identify it? This is the maxillary, number 2, maxillary air sinus. Is it clear? Yes. واضح حبايبي؟ طيب. I think we finished this model.